From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
On today's show, we're discussing new research about how low-carb diets, low-fat diets, and overall diet quality affect cardiovascular health. I'm Kate Schweitzer, Associate Managing Editor of JAMA Medical News. Staff writer Samantha Anderer is here. Sammy, thanks for joining.
Thanks, Kate.
So, Sammy, tell us about this study that you covered.
So in recent decades, the pendulum of popular diets has swung back and forth between low-carb and low-fat. There's ongoing debate about which one is better for weight loss and overall health. But studies have presented mixed findings, possibly because these dietary patterns can include food of any quality. So in this study, published in the Journal of the American College of Cardiology, the researchers wanted to compare the effects of carb and fat intake and diet quality on long-term heart health. They were looking to answer the question, if you want to reduce your risk of coronary heart disease, should you focus on a low-carb diet or a low-fat diet? Or should you focus more on food quality? In other words, healthy or unhealthy foods. To do this, they examined data from 3 large cohort studies with more than 30 years of follow-up. Participants answered questions every few years about their diet, lifestyle factors, medication use, and chronic diseases. The researchers used the food frequency information to index healthy and unhealthy low-carb and low-fat diets. Their definition of healthy included vegetable proteins and fats, non-starchy vegetables, whole fruits, legumes, and whole grains, whereas they considered animal proteins and fats, potatoes, refined grains, and added sugars unhealthy.
And what did they find?
Well, the researchers found that the healthy versions of both low-carb and low-fat diets were associated with similarly lower relative risks of coronary heart disease, which included self-reported coronary revascularization, non-fatal myocardial infarction, and coronary heart disease deaths. The unhealthy versions of both diets, however, were linked with similarly higher risk. Healthy diets were also linked with improved lipid and inflammatory biomarkers, including lower triglyceride and C-reactive protein levels and higher HDL cholesterol levels.
Okay, so the findings suggest that diet quality may matter more for heart health than specific macronutrients?
Exactly. I spoke with Dr. Dariush Mozaffarian, a cardiologist and director of the Food is Medicine Institute at Tufts University, who was not involved with the study. He told me that by itself, this study doesn't prove cause and effect, but that it's consistent with a wealth of other evidence over the last 20 years that we need to be shifting from a nutrient focus to a food focus. There are, of course, limitations. The study population was made up of health professionals, and so the results may not be generalizable to everyone. The study also doesn't address more extreme dietary patterns, like the ketogenic diet, and focusing on macronutrients, that's carbs, fat, and protein, may be worthwhile for certain conditions or for people who are trying to build muscle mass. But for most people, the experts I spoke with said it may make more sense to concentrate on a well-rounded diet of whole foods, which may offer more flexibility than specific macro goals. This study is really timely because now many consumers are focusing a lot on protein, according to Dr. Mozaffarian, who mentioned grocery aisles lined with products like high-protein cheese puffs and pastries, the latest effort to rebrand highly processed foods as healthy. His reminder, it's not about the macros, it's about the food choices.
Thanks, Sammy. All right. If you'd like to learn more, we'll include a link to Sammy's story in the show description. You can find that and all of our stories at jamamedicalnews.com. Thanks to Samantha Anderer for joining me. I'm Kate Schweitzer for JAMA Medical News. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.